first name?
Yes.
Okay, because I'm Brenda. And in particular, we want to know about the kinds of things that you have observed that you are most concerned with in terms of the major health issues of the farm workers and their families, because I know that you, since as a family practitioner, you're not only serving adults, but you're also serving children. You're also delivering babies. All maybe less so these days.
That's my daughter.
That's your daughter. You delivered your daughter. Wow, that's special.
That's another story.
Okay. But what are some of the major health issues that you have observed that you're concerned with?
Well,
You may need to speak
health
up because
issues.
the room doesn't
Yes,
have the acoustics.
okay. First of all, I would like to thank you all for being here. I see that the job in front of all of you is incredibly important, and I'm really glad that you're working on, gaining more knowledge and stuff like that. You guys are just absolutely, I ought to be in the audience talking. You guys ought to be up in the front. I mean, it's so important the work that you do. And I say that because I see this transition that goes on between the recently arrived and then the next generation. And you guys are taking it up there. And that's where really the rubber meets the road. I mean, they're getting here from Mexico, they're getting a job, they're getting themselves rooted. But then what comes next? I came from Mexico. I might have dropped out of school in 3rd grade. Most of my patients come from ranchos. You know what ranchos are, probably most of you. They're little rural and incorporated communities, which may or may not have electricity, may or may not have a school, may or may not have a doctor. They're just basically little rural municipalities all over Mexico, and that's where practically all of my patients come from. And they're landing in the 21st century, and their kids are jumping from that background to where? And you guys are right there. And it's so important what you do. It's so important. Now, health issues. Nutrition is a big one. The availability and accessibility of good nutrition and understanding good nutrition, I think, is really, really important. For the adults and the children. And this goes for what they eat in the house, and it also goes for the school lunch program, which many of you may be familiar with. Nutritionally questionable, I think, in many ways. And unfortunately, I don't know what we can do about that. Obesity is certainly a huge problem. And then all the sequelae from that: hypertension, hypercholesterolemia, diabetes, fatty liver, which we're researching with with the Berkeley Research Group. I would say nutrition is basic and important, and poorly understood. I wish we had more nutritionists on our staff. I wish we could spend more time teaching, because it's so important to understand what's good for your body. Health-wise, self-care is difficult for the field workers in the summers when they're working. It's pretty much a Jekyll and Hyde situation for these people. They're off in the winter. There's time. There's free time, more things that they can do besides work. And then summer hits and they're gone. Both parents, they're gone. The kids at the babysitter or the kids at school, but the parents are, both of them, off there. And it works up and gets to be really intense through June, July, August, and starts tailing off again. But consider if you're using insulin, consider if you're taking medicines 2-3 times a day, and you're just, you're hustling to get up at 5 o'clock in the morning to make the lunches, to get your kid to the babysitter, to get back and then go to work, and then all these things. Self-care becomes very difficult for people with chronic illness. And of course, you have things like, are you going to take insulin needles out into the field where it's, not very clean, et cetera, et cetera. That lifestyle is a very unusual lifestyle. Most of us kind of work at a level, and it's the same in the winter and the same in the summer. But this is like, for these people, it's like night and day. Some of them are working 7 days a week in the summer, 10 hours a day. So self-care makes it very difficult for people that have chronic illness. Children, I'd say the biggest health issue with children is that they just don't get enough exercise. And I think of my own self as when I was a kid, I rode my bike to school 2 miles each way. We had gym class every day. When I came home from school, I played basketball, baseball, football with my friends until it got dark. Saturday and Sunday, all day, every day. And these kids don't have that, at least in my neighborhood. They don't have that kind of access. The streets aren't safe. They can't go out to the park. The parents are afraid to let them out of the house. So what do? They stay inside. And what do they do inside? They play video games. And what do video games get you in life? I don't know, not very much. They certainly don't make you healthy, either from a mental or physical standpoint. So these kind of barriers are, they're bigger than medicine, really. They're not, it's not like, okay, I've got a medication that's going to, give your kid a healthy diet or a healthy exercise routine. I don't have that. I wish I did. But these are these environmental things, these huge cultural jumps, and this crazy lifestyles, and this, going from one whole culture to another. It's so confusing and so mixed up, and it's these kids just navigating through it is, you guys are part of that. Yeah, it's really important. Anyway, I'm sorry, I probably went too long. Go ahead.
And you're probably seeing kids that are also part of gangs and.
Oh yeah.
And
there's bullet holes in the windows that are gang graffiti. Yeah, sure. And there's prostitutes a block away, and you can probably buy any drug you want within a 100-yard radius where we work.
So we're seeing a population that has very high diabetes, very high obesity. And there was an article that was just published in the New York Times this week about fatty liver disease, particularly in the Latino population. And as you have pointed out, those diseases predispose for other diseases in adulthood, like liver cancer, as well as cardiovascular disease, stroke, etc. Yep. So we're definitely concerned about where our children are headed here in this community.
Yep.
So, Irene, from your point of view, dealing with the female farm workers in the fields, what are some of the social as well as medical issues that they have told you about, or that you have seen personally?
Mm-hmm. So definitely many of the things that Charles mentioned, right, come to mind. But I think with women, it's neat when you're interacting with the women, because they're the head of the household, right? They're many times often working in the fields as well, but they take care of their family. So we hear a lot of the feedback about the lack of preventative screenings. Many of them, even if they might have some kind of health insurance, it's not the best quality health insurance. They might not take advantage of it due to immigration status most of the time, right? And we saw a lot of that during COVID. I think definitely they feel more comfortable talking about their children's care. And then sometimes you talk to them, well, what about you? Have you gone to the doctor? Have you had your preventative breast exam or screenings? And many of them, we hear that they don't. And when I mentioned during the pandemic, there was a lot of fear about the public charge, right? That if they took advantage of any free services or, healthcare coverage, Medi-Cal, that they might later not be able to seek their residency, complete their immigration status.
Is everybody familiar with the public charge issue? So maybe you can
No,
just go into
okay.
that.
Yeah, I used to be a lot more like during that time, but the public charge was more that if you had any pending, like if you were trying to get benefits from the government, dependent of the government, you were considered a public charge, and so that could impact your getting your immigration documents, because you'd be looked at as sort of I guess it kind of explains itself, right? A public charge.
So it means that many people did not want to, even though they had the right to benefits, they
Mhm.
didn't pursue those benefits because they were scared and they were not educated about what they could and couldn't do.
Mhm.
some-
And it came out as
yeah.
news that you wouldn't be considered public charge, but it really was very real that you could be a public charge, and then it changed. And so convincing people and letting them understand that there is no need to fear, getting these free, COVID testing or any type of health care. So what were you gonna say?
No, I was just gonna say that there was also an issue, and I wasn't on the front line, so maybe you guys know about whether you could or could not get care if you were undocumented, and what that is right now. If you're undocumented, can you get care? And my understanding is you can only get emergency care. Is that true?
It was only that you can, yeah, emergency care. Anyone, you cannot be denied care right in the emergency room. And then I believe that the Medi-Cal expansion, it just passed.
Yeah.
There was limitations with age there. Now they expanded the age.
And they're gonna expand it again.
They're- Yeah, right. I mean, we really are headed towards
Coming up.
healthcare for all.
And also pregnancy is another
So-
qualifier for
Could
Medicaid.
you speak
Oh,
up a little
yes.
bit?
Pregnant.
No, just emergency, it's emergency and pregnancy. So any pregnant woman can get prenatal care. And we do a lot of that.
But it
a lot.
means that if a woman is undocumented, or man, or anybody is undocumented, they can't get preventive care. They can't get mammograms, they can't get screening of any kind unless it's in an emergency situation. So it means that you have 40%, we're giving different estimates from the last time, how many are actually undocumented in our community. And it's something between 40 and 60%. That's the estimates that I have,
Undocumented,
undocumented,
70.
70%
In California.
in California.
Over
Okay, so we're getting a range of, and if you remember, some people consider the H2As as part of the undocumented and some people don't. So that's part of the difference in
Okay,
the
yeah.
proportion. H2As are here on a visa from usually Mexico to work in the fields for just 10 months or whatever the fields require them to work, and then they go back. But those people are provided medical care because it's part of the H2A, but the others are not.
Exactly. Yeah, in order to have if you're a grower and you want a secured labor force, you're going to pay a lot more money, right? That's why usually it's the bigger corporations that could afford to bring H2A workers, and they have to offer housing and healthcare, and they have a lot more protections for sure. But they also, we have found that a lot of them are facing a lot of abuses as well, especially like if they are injured. Many times they're just sent back to Mexico with no safety net, and many times they're not going to be paid to come back, right? Selected.
So we're talking about physical health right now, mostly. But I want to turn to mental health and social health. We hear a lot of issues, not only about gang activities, but about abuses in the fields, and especially for women.
Mhm.
And I'm wondering if you could address those issues.
Yeah, definitely. I mean, I think, just again, to me, much of this just leads to their immigration status, right? They're living in the shadows. They're a lot more vulnerable to abuses, to retaliation, and so many of the women, Lideres Campesinas sort of started over 35 years ago because of abuses going on in the fields, discrimination. And so we still see it. I mean, I just got a call this week from a man whose wife was harassed in the fields, maybe, well, not maybe, I mean, I don't know because I wasn't there, but touched inappropriately, right? So he's battling that out with a supervisor, but you hear nothing from the actual company. Nobody's responding. And so when this man, tried to stick up for his wife, um, he faced a lot of bullying, harassment from his own supervisor, and eventually lost his job. And so that's just 3 days ago, right? Of when you think these things wouldn't be as common, they continue to be. We do a lot of outreach throughout the state, in form of theater, in form of educational sessions, and this is to encourage women to speak up, because it definitely is something that happens where women are sexually harassed or even assaulted, right, by their supervisors, and ultimately they use their lack of immigration documentation against them. And so it's definitely common.
We were doing Kim and Ace and I were doing a study a long time ago where we were giving workers replacement clothing so they wouldn't bring home pesticides.
Mhm.
And we were told, oh, for women, we had to supply a sweatshirt. And the reason why we had to supply a sweatshirt is they had to tie it around their waist because they couldn't bend over in the fields because of sexual harassment.
Mhm.
And that it was very prevalent and concern of the women.
Oh, yeah. Also the bandana, I don't know if you notice, the use of the bandana. I mean, mainly it's to protect from the sun, pesticides as well, but also because women want to hide themselves, right? It's a part of that as well, covering themselves up.
On their faces.
Yeah. And then domestic violence is a big part of what we do. And right now is Domestic Awareness Month for domestic violence. And so that's a big thing that we deal with, where we have a few victims advocates. We accompany women to court. So really, I think even in your profession, right, that being trauma informed, right, especially with many of these women that don't speak even Spanish, they speak indigenous languages. Many of them don't speak up about this. They don't want to get their husband in trouble. But we deal a lot with domestic violence in the homes. We've seen many situations lead to an entire family being killed, or the couples killing themselves, right? And so it's very hard, and then that impacts obviously the children, the families, the communities. So and then it's a lot of the hardships that happen with the situation that people are living in. I mean, living in constant poverty, not being able to put food on the table. I mean, imagine the stresses, right? And we saw what happened in Half Moon Bay, right? Yeah, and he was old Iran Chinese, living probably in a, how do you call the containers that are makeshift homes? Yeah. And just the stress this man was probably going through, not to excuse, of course, what he did, right? But with that entire community was devastated. And over there's an incredible organization, one of our partners, called Alas, and they focus on mental health. Ayudando Latinos a Soñar, Alas. Belinda's she's a counselor, Dr. Belinda Arriaga, mental health professional.
So Charles, have you also seen some of the mental health issues affecting the community? And I guess we should also talk about what the role is of the immigration policies and how that might be affecting mental health as well.
Yeah, well, let me just start by saying that I'm not an expert on immigration. laws, so I'm probably gonna keep away from that issue.
Can you hear in the back?
Yeah, I'm sorry, I don't talk really. Mental health. Well, first of all, yeah, not reporting things is a big deal. And going back to physical, just briefly, the whole workers' compensation system is a whole thing that I deal with on a day-to-day basis. And I see people coming in injured from the fields and they're afraid to report it because if they report it, they think they're going to get fired. And sometimes they do. And that's a big one because workers' comp is it endows the claimant with with certain legal rights that they have and they all have, and it's so important that they take advantage of that. And I lecture people about this all the time because I don't do workers' comp. We're not contracted with that at all. So we can help you, but if something happens, you know, you're out of the system and you're not going to be able to make any claim. In terms of mental health, well, you know, I mean, poverty is a stressor, isn't it? I mean, it's a big stressor. Being away from your family, coming to the United States, maybe by yourself, you know, living in a rented room or even less than that. You know, really just hand to mouth and not knowing where you are, what you're doing, not being able to navigate. And as you say, speaking, you know, pre-Columbian language is your first language. All that is undoubtedly stressful. I see all the time people coming here and leaving their 2 grown or semi-grown children in Mexico with the grandparents because they're not going to try to make them across the border. And you know, let's imagine what it would be like, you know, if you're 5 and 6-year-old, you never saw them again. So it's really difficult. And then of course the work season, again, it becomes a super stressful situation where, you know, you're just, you know, you don't have a minute to stop. You're working 6 days a week. Sunday, you're going to Walmart, doing the wash, you know, getting everything ready. And then Monday you're back there at 6 o'clock in the morning. And, you know, I have an illness. I don't know if any of you speak Mexican, argot, but there's a word called desguanzado, which means I'm completely burned out. And I have a disease that I call desguancitis. And it happens in about September when I have women come in and it's just like falling apart. And it's basically, okay, what's your day like? Well, I get up at 5 o'clock, I make the lunches, I take my kids to the babysitter, and then I go to work for 12 hours and I come home. I do that 6 days a week, and Sunday I'm going to do the shopping, do the laundry, you know, getting everything ready. And I do that week after week after week. And like, you know, usually around September, they're literally falling apart. And it's just from overwork. It's just overwork. And and any of us would be in the same boat. Mental health, drugs, it's out there. I mean, you know, not so much in the women, the field workers that I see, but yeah, the men. Problems. Alcohol is probably bigger than drugs in that population. And then the repercussions of that, families falling apart, domestic violence, so on and so forth. For the children, and again, you know, this is your territory. It's, you know, the parents want their kids to be better than them. They want to support the children. They want their children to go to college, but they've never been there. They have no idea how to guide them. They have no idea of how to advise their children or give them ideas about how to get through this. So these kids are kind of like drifting on their own, and hopefully they have some guidance counselors at, you know, high school and maybe a middle school level that can help them orient themselves a little bit, but it's not enough. And it's easy for them to get lost and get sucked into the gangs or get sucked into a video game habit or get sucked into all kinds of crazy things. And the internet is another risk in this. I mean, there's, you know, we all know what's on the internet. Anything is on the internet, and the parents don't really know what the internet is. I mean, they don't really know the capacities or the content, most of them, because it's just, I mean, it's not even close to what they grew up with. And I mean, there's, for an example, you know, I did a little case study of I see a lot of boys that are maybe in their early teens because they don't want to see a female doctor. They're, you know, they're shy, so they want to come to me. So I do an awful lot of these boys. And for a while, I would just sit there and ask them, I would say, you know, in part of my private discussion, I would ask them like, oh, have you ever watched pornography on the internet? You know, 15-year-old boys, and then, you know, maybe half of them, at least. And, you know, that's like something that's really forming an image in this young mind about, you know, relationships and violence. And there's no stop to it. I mean, there's only 17 states in the United States that have an age qualification to view pornography on the internet, and California is not one of them. This is really bad, and you see girls cutting themselves. I mean, because what are they thinking? What's the image that they're, you know, what's some smart little boy coming up to them in you know, 6th grade and showing them you know, on their cell phone, hey, look at this, you know, and it stays in their mind. This is, you know, this kind of stuff is very difficult. And then you add to that the poverty and the like inability to have a parent that can kind of see the big picture and kind of guide you through and get you through that, you know, your postgraduate degree. It's just a lot of stress, and it's really easy for these kids to get lost. And, you know, you guys are there.
They provide the models.
You guys are there. You guys are, you know, right in the front line of this.
I mean, one of the concerns that we have is not just about the women and abuse, but child abuse and neglect.
Mhm.
Have you heard about that? How rampant is it from your experience? And it's hard to talk about neglect in this population when the whole population is neglected. But I'm just curious if what experiences that you've had.
Well, there's definitely just a lot of underreporting, like everything, right? But I could say some of the work that we've been involved in the last 2 years is, I don't know if any of you have heard of the ACEs survey, right? That you fill out when you go to the doctor's appointments. They were finding that a lot of, especially like farm worker women or Latina women, weren't really either filling it out or giving much accurate information, and so there. A lot of clinics are working with our organization and other organizations to make it more trauma informed and to actually have conversations with people so that they feel more comfortable. And so we actually changed it's still a pilot right now, but it's called NACES instead of ACEs, and having kind of to do with rebirth, or NACES means birth, NACE. And so it's a more comfortable way of actually engaging, having trusted messengers engage with people so that they feel comfortable actually reporting incidents, like whether it be child abuse or domestic violence in the home, drug use, anything that could potentially obviously get someone else in trouble, right? Or get them somehow documented in the system. So yeah, that's I think, yeah, like everything, we get a lot of cases of child abuse, and trafficking even. Yeah. Teens.
So let me turn to one last question, and then I'll turn it to the rest of you. And that is whether or not you believe of the cause of climate change, it's happening.
Mhm.
And how are you seeing that climate change is affecting this community? In what ways? Whether it's the adults or the children or the farm work. If you could just think about that for a second and comment on that. Especially around farm work and agriculture in this community.
I mean, I could share something. Well, first of all, we saw a lot more migration due to climate change, right? People weren't able to do the same work in their own countries, and so started coming to the United States. I mean, we have people from Honduras, Guatemala, Mexico, various countries where climate change was already impacting their work in their own countries. And over here, yeah, I mean, just with the floods recently, I mean, that made our work a lot harder as a farm work organization, because you're dealing with so many more families in need during the floods, being left out of work, like Charles was mentioning, the devastation of the strawberries here. So one of the big things that we've been advocating for, and I find it directly related to climate change, is a lack of unemployment benefits for farm workers because of the drought, because of the floods, aside from, you know, many other issues, right? But the fires as well. We work in Sonoma Napa a lot. We have a project there called Fire, where we're helping kind of understand, have our communities, indigenous communities, sort of become more in touch with traditional practices of how to cure the land, survey the land, and maybe, you know, better ways of fire prevention. So that's definitely, we've seen farm workers definitely, as you've probably seen some of the images of them working in the smoke, in the heat, in the rain. And so that's obviously going to contribute to a lot of health issues as well. But the Safety Net for All is a campaign that now has become it's a 2-year law, SB 227, which is fighting for unemployment benefits for all workers. Because many of them we saw, especially this last year, out of work for a very long time because the crops were destroyed.
That's regardless of documentation status?
Yeah, this is for excluded workers because undocumented workers do not get unemployment benefits, yet they're putting into it, you know, billions of dollars, but none of them have been, you know, able to even receive stimulus checks during COVID. So we fought for a lot of some, you know, small relief payments that farm workers got. And then actually right now we are a part of the organizations that are distributing $600 from the USDA, the federal government. So it shows that this can be done, you know, and these are related to this COVID still. So anyone that worked during the pandemic that's a farm worker is getting $600 payments. And it's a burden on nonprofits to do that. Believe me, I'm burned out, as mentioned, because we weren't prepared for such a system to start distributing funds like that, but we're doing it because it has to be done. But if the government and EDD could actually give these funds, it'll be a lot easier than nonprofits being in charge of that work.
So the reason probably being is that they trust you, they don't trust the government to say, hey, I'm undocumented, give me my $600.
Yeah, that could be true, but I think it's maybe because we have that direct contact with them, right? And yeah, I'm not too sure.
So Charles, have you seen any changes because of climate change?
Well, again, you probably know better than I about this. I read some statistic recently that the last 20 years in California have been the driest in the last 800 or something like that, 1,000. And I heard stories about the Central Valley, you know, not now, but, you know, a couple years ago, there were farmers over there that were not farming anymore. They were just selling water because it was more profitable and they didn't have to do anything but pump it out of the ground. So, you know, there's some issues there with drought, or, as you said, migration from Mexico. I just want to put in one little plug though about migration from Mexico, because, you know, what's driven migration from Mexico in a lot of cases has been NAFTA. And it's taking, you know, GMO modified grains that are produced dirt cheap in this country and sent down to Mexico. And these little farmers, these exact people that I'm dealing with, were, you know, doing little subsistent farm work and selling the extra on the market and stuff, can't even come close to competing with that. So they're wiped out, basically. And that's not climate change, but that is something that has really driven, I can testify that it's really driven a lot of migration northward. this last year when the strawberries was a disaster, and the rains wiped out the strawberries, as you know, were planted in the fall. And so they're subject to the rains in the winter, and a lot of the strawberries were bad this year. And a lot of my patients came in mid-August when they should be working 10 to 12 hours a day saying, I go home at lunchtime. There's nothing to do. And it's going to be a tough winter this year for those people. It's going to be a really tough winter. Making ends meet. Other than that, climate change.
Have you seen a change in their work schedules? Or,
Oh, yeah.
No?
Sorry, I was kind of spacing out, like thinking of what you were saying. Definitely, they're making, last time I just recently asked a contractor, it's about $1,200 a month that they're making right now due to the cut in hours. And like you mentioned, right, that you're seeing some of your patients that should be
Yeah.
at work. Normally it would be at work, but
They can't
So
even pay their
$1,200 a month
childcare,
is-
basically, let alone make any money.
yeah.
so does that mean their
About
kids
30 hours a month is what I heard.
30
Every region's different, right? But this is in Yolo County, which was even less impacted as like other Central Coast regions, Tulare, Central Valley.
Probably one advantage we have is that we're not so dependent on rainfall. You know, we have groundwater here, and as long as the aquifers hold out, it's a little easier to produce food. I mean, it's not like you're out in the Midwest someplace, and if it doesn't rain, you're washed up. You don't have any crops. So we do have a little bit of a cushion in that sense, I think, from groundwater, but then groundwater is not infinite either, and we keep pumping it and it doesn't get replaced. Eventually, I would imagine it's going to become a big issue too. We are in, I mean, all of you live around here, I assume. I mean, we have some of the premier, ocean research institutes in the world right here, Moss Landing Marine Lab and Monterey Bay Research Institute and the aquarium. And they have extensive programs in education, and that's the cutting edge of some of the best, smartest people in the world working on ocean stuff. So, keep that in the back of your mind.
Okay, so why don't I open it up to before lunch? Some questions from the group?
For you, you mentioned the salary. Just so I have an idea, what would a farm worker, maybe fresh, or does the salary vary? If you've been doing it for a number of years versus new, does it vary by the crop, and kind of annually, what are they making?
Annually, I believe it's estimated about 25 to 30,000 is the annual income of the median income of farm workers. And
And then there's, like the strawberries, for instance, they're paid by how much they pick. So if there isn't any fruit, even if they're out in the field for 10 hours, and there isn't any fruit out there, they're not going to make that much money. So it's, I know the strawberries like that. I don't know, probably all the berry crops are, but I'm not sure about
by
lettuce and
contract,
things like that. But it's how much you actually produce picking. And my patients literally run, some of them up and down the rows, to save time so that they'll be able to pick more.
And that's why too, during the pandemic, it was a lot of the either older workers or women that were sort of the first to go when you had to limit the number of workers out there because they weren't as fast, right? But definitely vineyard workers tend to make a little more. Especially, the regions like Napa, Sonoma, it's a lot higher cost of living, so sometimes that doesn't even matter, right? But many who do, they drive there, right? They commute to work just to be able to make a little bit more money. Monterey County too, the vineyards. It just does depend on what work you are actually doing, that depending on the pay, but most do make, the 14.
So 25,000, was it $14 an hour?
Yeah, I
So
believe it's
25,000 to $30,000 a year is definitely poverty level for a family of four.
Mhm.
And that explains, going back to the first thing that Charles said about nutrition, in Chamacos, which I will not be talking about today, we have 40 to 50% of our families are food insecure, and these are the farm workers.
Mhm.
So that gives you a, going back to what JP was talking about, we've got food insecurity of the people that are giving us food.
Yeah.
One other anecdote about this, which I find just wonderful, to just show the humanity of these people. When the real estate market crashed in 2008, there were thousands of construction workers, just the same as the field workers, that lost their jobs. They were out, forget it, goodbye. And they actually let them come into the fields. They actually, okay, I'll work 8 hours, you work 4 hours, or I'll work 6 hours, you work 6 hours. They actually, help their own people. I thought that was amazing. That they did for a couple of years like that. They were actually helping these unemployed, broke construction workers at least make enough to get by.
I was wondering if you've seen any increase in heat-related illness or issues with that.
In heat,
Heat-related
Yeah.
illness.
I mean, I think we saw a few cases of people who died this this summer, in different states, including in California. So I think definitely we're seeing, definitely heat-related illnesses. We get a lot of folks that will call us that have complained to their supervisors because they felt faint, all the signs of heat exhaustion or heat stroke. I had to sit, usually they'll tell them just sit down by the tree and don't get them the medical attention that
I was
they should be
curious about the comments on the sweatshirts also, because I worked in some tomato fields about 25 or so years ago. And a lot of the women would be super, super covered up with multiple layers, and they said it was for heat, that they stayed cooler, which I couldn't understand.
Yeah.
But now I'm wondering if it was more to cover their body.
I think it's a mixture of both, right? But to keep cool, protected from the sun, the pesticides.
Because they would
Yeah.
have a shirt and flannel and a sweatshirt over that, and just be completely bundled up, and I was keeling over just looking at them.
Yeah. And also due to immigration status. I didn't mention that one, but yeah, I think all of those are factors.
Why would
And-
we wear a lot of clothes due to immigration status?
I mean, you have people coming to visit the fields, or they're going to want to, even if you're from a community-based organization, they won't sometimes take off their, they don't want to be identified.
They totally,
Yeah,
you know,
the bandanas,
up and
Yeah.
and
Inspectors, right? If the government happens to come, I mean, we saw tons of raids, and also it's important to make a connection between H2A and the raids that occurred in 2015. I really got to see a lot of that working. I used to work with the National Agriculture Workers Survey, and we saw tons of raids on the East Coast, and that's where H2A first dominated and started taking, started taking place with bigger farmers. And we saw a lot of small farmers, organic farmers, families who had been farming for hundreds of years, taken out because only the big corporations could afford, these H2A. And anyways, there was tons of raids happening. So I remember going to farms in Georgia. I mean, people were very scared to even talk to us. And then we started seeing the first raid here was in Santa Maria. People who had been there for 25 years were deported. I was going to mention something too that I'll never forget. In the Salinas Valley is the la brisa, they call it, the fog. It burns your face, right? And some of that gear is very expensive, and so it's something that I've always actually wanted to do. Is one man told me that the only thing that really worked for him was the military style, that like beanie mask combination type of thing. That it was expensive though, like. I think they're very expensive, but that's the only thing that really protected him from that burn of the fog.
The wind?
The wind, yeah, la brisa, the fog, the wind, like a ski
Ski
mask, thank
mask,
you.
like
So I really wanted to, at that time Obama was president, I was like, maybe we could get military gear donated. But
and I think with from where I practice, this close to the ocean part of Monterey County is definitely cooler. I mean, if you go into the South County, it's a different environment completely, and that wind is serious. I don't know if you live down there, but I mean, it is serious. It's got a lot of dust in it, and God knows what other kinds of chemicals could be in it from all the sprays. But you know, I'd say overall, the incidences of like people being in the field and getting sprayed by a helicopter or something like that, I think that's gradually diminished over the years. I haven't seen any of that happening, at least around me, for a long time.
Well, especially around in Salinas Valley, because most of the sprayings are not happening that way.
Yeah, I think they're being a little more careful about it. In terms of the people going into the fields, I don't know about that. That's still it's all you drive by the fields and you see these gigantic billboards and you wonder what they actually say and who can read them. But they're probably still getting exposed to the pesticides in the field. And just go off topic for a second. I mean, the first presenter was a really nice guy, but do not think of pesticides and medicines in the same intellectual category. They're not placebo tested for safety and purity and anything else. They're tried, and then let's see what happens. And they're not. It's not an equivalent thing to say this is a medicine for plants. Please don't think of it like that.
Less than 5% of all chemicals are actually tested.
In terms of human health, I think that Charlie's talking about plant health, but I can't comment on plant health. But in terms of human health, many of the pesticides that have not, especially the older pesticides that have been used for a long time before the regulations came into being, don't get researched until they're relicensed. So, and that a lot of that information is proprietary. Right?
You mentioned the transition from small to big corporate farming having a ripple effect on undocumented workers on the East Coast. And I wanted to ask
All
about
over now.
Huh?
Definitely all over now.
Yeah, I wanted to ask
Oh,
more
okay.
recently, because you said that was in 2015.
Mhm.
But more recently with the cost of living increasing, as you know, like a ripple down effect of cost of crops and so on and so forth. And I wanted to know a little bit about how that's affecting the workforce, because if you're seeing a decrease in hours and things like that, it could, I don't know, be revolving around the fact that some of the farmers that are smaller farmers are not able to produce at the high volume capacity to make it worth it to farm. And so therefore they're decreasing the hours for their workers, or they're going bankrupt. And so I'm wondering if you've seen some of that in this region.
Yeah, I mean, I think you have the answer, right? I think many of them, you're right, they can't afford sometimes to pay their workers. This happened too during the what is it called? The overtime law that passed. A lot of growers use that obviously as an excuse too, that they can't afford to pay the workers enough to get the actual work done, because they were depending on workers to work, the weekends, over, probably like over 60 hours a week. And so now a lot of times how people get through that is they'll use a false name, because people still need that work, right? They're dependent on that work as well, the workers. So in order for growers to get past paying overtime, workers will use a different name, a false name, and still get, on their side, they get to make money still, and then the grower doesn't have to pay overtime. But I think definitely this is my opinion, but there's a big need to scale down the ag industry again to smaller farms, and also to improve the quality of our foods, right? Because when you have this huge monopolization of our food, they're dependent on these big chemicals. Pesticide use is a lot more rampant with the big companies. That's during mass production, and so I think that's definitely had an impact on the labor force, because it's ironic, right, that we're talking about a lack of labor force, but yet we're deporting or taking certain local workers out of work, and then bringing in workers. It's a little interesting, but there's another new project that's coming out through the U.S. Department of Labor, and we're probably going to be a part of that. We were a little hesitant, but it's good to be able to assess like how these H-2A workers are treated and how to preserve the labor force that is here and keep them in work. So things are going to change for the positive, hopefully, in that respect. Also, there's a new law that we really advocated for that just passed, SB 831, and that's by Ana Caballero from, this district. We gave testimony to all the committees for that law, and that's to open the pathway to citizenship or residency for farm workers. And it's a pilot project because nothing's being done at the federal level. So California will be sort of the lead on having this relationship with the federal government and see how to make this work faster.
It did pass.
It did pass, yeah.
So it's going to start being in effect soon.
Yeah, it's I don't know exactly how it's gonna happen. I think it's to establish like a work group, and California governor is to work with the federal government, and so it'll probably be about 3 years to see this, but it's a good first step, right? Some people thought it wasn't much, and maybe it's not, but I think it's actually a really good thing. So if you can look it up and read about it, SB 831.
It's such a troubling dichotomy where you have such this incentivization by industry to encourage people to come into these harsh environments, and yet at the same time, general public is blaming. It's like politically expedient to blame and things on the internet, things like that. I'm just wondering, what do you see as the most like hopeful practices, to help ensure that larger industrial farming operations and all farms actually are responsible for taking the health and well-being of workers who are being incentivized to come over here and do the work.
That's a great question. I think, some good things came about during the pandemic. Like one of those is the CWAP program, it was the COVID Worker Outreach Project. Now we're calling it more like the California Worker Outreach Project. But what has been tough is that barrier of employers not wanting to work with us. And so now it's becoming a lot more intentional. Now it's actually under the DIR, the Department of Industrial Relations. So we're getting closer and closer, right? Everything step by step to making it an actual intentional effort to work with employers and community-based organizations to have better high road practices with the workers. So if employers were more open to that, like what we were doing a lot in Monterey County with the collaborative was even being intentional about having health professionals come and do talks about COVID-19 and now about heat illness, right? Any type of thing when we know that over 50 or 60% are not covered by health insurance. If growers were a little more intentional about actually caring about, the health of the worker, their workers' rights, and being open to working with those who are doing the education instead of constant battling, right, and these barriers. And so what I would love to see too is the government incentivizing organic growers or growers that have these high road practices. So maybe there's sort of like a checklist. They all have to have a prevention illness program. And a part of that, like if you have a healthcare professional come in and do talks, that actually counts in your illness prevention program. But even growers are in a weird position too, because they don't want to get in trouble if they have all these undocumented workers, right? So everything is just, it shouldn't be this way. So hopefully if the immigration situation gets settled, then there's no excuses anywhere, right? Yeah, but that's a great question.
Jennifer?
I'm curious what experience actually either of you have with like community schools and centralizing the resources for the ag workers, and whether that maybe breaks down some of the stigma of government control, kind of whether there's more openness to go to their kids' school to get resources.
For who to go to the kid's school, the parent or for,
Yeah,
for,
anybody,
or-
just kind of just having centralized access at the schools rather than, you know, going to the county building or something.
Or the NGOs or this.
Yeah.
So in other words, using the schools as the conduit of information to at least the
Yeah.
parents in the community.
yeah. We've done a lot of health resource fairs, different kinds of resource fairs in general at elementary schools, especially during the pandemic and still now, like there's gonna be a really nice one in like in Walnut Grove with the Mexican consulate at the elementary school. We did a lot of vaccine clinics, COVID testing at schools. I think that's definitely a great hub and it should be, right? That should be a safe haven for families and schools. So doing more of that is great and inviting community-based organizations that have a, you know, expert, I guess, navigation practices. There are many community health workers that have a good grasp of what services are out there. Inviting them to the schools is great. So I'm a big, definitely like a proponent of that. Yeah.
I was, if I could just add to this,
I'm sorry,
Oh,
Carl.
sorry.
um,
1 second, Charles, you want to?
to put yourself in the shoes of these people, they're in a world that's alien to them. And the first thing they have to establish is some kind of trusting relationship with other people that are already here. And I'm probably in that category, you know, I meet a lot of people that, you know, just first show up, you know, with whatever, and, you know, we talk and, you know, we have some trust build up, but you guys are the other side of that. You know, you're probably like right up there in the very top of the list of people that they trust. And so, yeah, so using the schools for this kind of, you know, community stuff, I think is a great idea. And I wish personally I could go out in the schools and actually have a clinic there. I mean, I would love to do that.
What some of these community schools have are doctors and dentists and
Yeah,
Mhm.
organizations and
we've
banks and everybody
Yeah.
kind of there.
we've talked about it in my organization. It's never really happened, but you know, it is one of the first places that I think the new arrivals especially are going to establish some sort of root and trust. And again, it's you teachers are so important in that process.
And during COVID, that was the case. There was vaccinations in schools, and you know all of this, and the testing in the schools, and you're working with the superintendent to develop all of this for this area. So maybe that could be mushroomed into also other kind of information like you've done.
Yeah, yeah.
Question, I hear a lot about the growers and big companies, and usually they're pretty receptive to some of the rights of the workers, but has anything been done to the contractors? Because,
Farm labor contractors.
Yeah, they're like labor contractors, they.
No, yeah, yeah.
do whatever. And,
That's
I've never seen anybody like push them a little bit to be more humane and to treat people better. And I remember when I worked in the fields, if we work for a company, you were doing okay, you were doing okay, not the greatest, and it was pretty hard job, but you make okay. But then a few years after everywhere, contractors, companies did not hire anymore, just labor contractors, and they took away insurance, they took away overtime, they took away everything. And I never heard that anyone trying to talk to them or pass laws to protect their workers against that type of.
Oh, yeah. And I guess it's my mistake, right? I go straight to the grower because the grower is the one who hires a contractor. And I don't like to ignore that important aspect because it's very easy to be a grower and hire contractors and release yourself of any responsibility. I look at it as whose land that is, who's growing that food, they should ultimately be responsible. But you're right. I mean, contractors are definitely to blame for many of the abuses and yeah, I think there's actually a law that we want to kind of do some quality control on, which was the sexual assault or sexual harassment awareness training. Right before COVID, it passed, and we helped for that law to pass by doing a lot of surveys with labor contractors that were not doing the training. And so that law passed requiring the labor contractors to do sexual harassment training, but nobody's overseeing, like, is it being done or is it not? And so that's some of our next steps too. And yeah, we're constantly, I mean, talking to labor contractors, especially with part of the CWAP project. Yeah, that's, I think they're,
Do you know how reliable, like, if I'm the big farm and I subcontract to pick my crops, how
Mhm.
liable I am from the contractor, no, I'm completely free.
you're completely kind of free. I
So
think.
That's my impression
Yeah.
too. I mean,
But you shouldn't be.
I mean, there are fewer, my understanding is that there are fewer farm labor contractors in the Salinas Valley, much more in the Central Valley, where it's really, most people are employed that way, from what I understand, right? And, many of the Salinas Valley farm labor contractors are former Latino farm workers that have now worked themselves up in the system. And at least anecdotally, I've been told that they can sort of circumvent some of the rules that the growers can't, because they're, they're legally responsible unless oversight over the farm labor contractors, but you guys have more experience with that than I do, but that's what I've been.
Yeah.
Yeah.
That makes sense.
There are very few companies left in the state of town. Most of the crops are picked up by contractors.
Here in this valley.
Yeah.
Ah, okay.
That's not like strawberries, like, I think Bristol is one of the few that still employs, but other than that, most of them are picked by labor contractors.
And that's why too,
I think that's a big problem for agriculture. They're not as liable as the company. The company does something, they go after the company, but a labor contractor.
It's like the Uber of the.
And they're taxing.
When we started working in Salinas Valley, we were told the land is owned by one person. The person who farms the land is a different person. The
Mhm.
person who hires the people is a different person, and then you have the farm worker. So you've got like 4 layers of people that can somehow shirk some responsibilities one way or another.
yeah. So we're also right now working a lot on assessing the interest of farm workers to transition to become, farmers, farm operators, and the owners of their own work, right? And sort of reclaiming their role in agriculture. And so just recently, this little documentary crew followed some of our work, and we went to the Central Coast and interviewed some small farmers that were also impacted by the floods. But he was, one gentleman specifically was explaining the amount of corruption involved in just being a small farmer. He's like indigenous, incredible at what he does, loves what he does, but he's being, he's pretty much being, I guess, what do you, like the bigger company, I don't know, I need to study him, or this was just like a couple weeks ago that we did this, but it was really interesting what he said. The bigger companies that come from like Texas, will, like their strawberries are the ones that sell the most. His end up like 2 weeks after he already sold them, they'll come back and like give him like less than half of, right, like what it's worth. And so they're like, it's not promoted to have your own small farm either. You're gonna get taken down by the bigger companies.
Is the cooler, do you know, is it, because they call them coolers?
Yes, that's right.
And my husband was farming as well, like a small farmer, and he
cooler.
decided to stop doing it because of the cooler issue of payout.
Yes,
And it
that's what he
was,
talking
the
about,
particular
cooler.
company was Coke that they were struggling with, and they became,
Coca-Cola?
it's called Coke.
Oh, okay. From Texas, maybe?
mm-mm.
Oh, okay.
It's just in
Interesting.
San Juan Bautista,
Oh,
farms.
interesting.
yeah.
Okay.
But they're like,
The coolers, yeah, that's,
also Central Valley, they have another corporation they combine with.
oh, okay.
Yeah, so they'll quote maybe like $15 a box, but then they'll come back and pay only $10 a box or something like that.
Yeah.
So I think that we probably, I know there are other questions, but we're really late for lunch. So if you wouldn't mind staying a little bit for lunch maybe, and if there are people who have questions that can corner you, would that be okay? So we can go on and have lunch, okay? So I want to thank our our guest. And thank you for
Thank
your
you.
work. to Help
Yes.
this community.
Yeah,
Thank you.
Please join us for lunch. If you can grab your lunch and then come back in, we'll get set up and we'll have Lisa and Brendan, we'll have a discussion around.
Did we get a picture with-
I wanna like pump your brain for all these policy things that are.
Oh, yes, well, you'll
All right, let's take
Yeah.
a picture. Like we really have been together.
yeah.
Except I shouldn't smile because I just had to choose. my-
Oh, really?
That was
You're
fun.
too late.
I had to choose, I had door surgery and a tooth removal last
Oh,
week.
yeah.
Will you stay?
Can we take a picture with you too, Charlie?
I suppose.
You want me to take a picture?
Sure. I'm all about the selfies, but.
Right.
Set up your laptop.